it seems like you have folks in the clinical world who are feeling incredibly threatened by
Mhm.
AI, the advent of AI.
I am of the mindset, at least right now, that it will not replace clinicians.
Welcome to Happy Hour, where we're flipping the script on the traditional happy hour. Instead of winding down at the drink, we're here to talk about what actually makes us happy and learn from society's healers, therapists, coaches, elders, spiritual leaders, and everyone in between. Join us as we dive into stories, insights, and tools that help us grow, heal, and support one another. Whether you're a seeker or a seer, this is for you. I'm Anurag, founder of Happy, and this series will be hosted by myself, along with my co-hosts, Mira and Tess, and we're excited to explore new ways to bring more joy and well-being into our lives. So take a deep breath, and let's dig in.
Welcome to today's episode of Happy Hour, where we have the pleasure of speaking with Karen Igu, a seasoned clinical psychologist. Karen shares her journey from hospital setting to her private practice in San Francisco Bay Area. We explore her insights on severe mental illness, the role of technology in therapy, and the importance of human connection. Karen also touches on clinician burnout and maintaining professional boundaries. And lastly, don't forget to like and subscribe.
Hi, Karen. Welcome to Happy Hour.
Thank you for having me. I'm excited to be here.
Yeah, it's really cool. We came across your profile and said, we need to have you on the show.
Thank you. I'm excited.
I know it's a funny time for Happy Hour. It's 10:21 a.m. here on the West Coast. But I think
fun.
happiness has been redefined in many ways.
Mm-hmm.
And that's a great place to start. So, Karen, why don't you give an introduction to yourself? And as part of your answer, can you share with us 3 things that you do to make you happy?
Ooh, well, thank you for having me, Anurag. So who am I? That's always such a loaded question. So I'm Karen Igu. You know, I present as a clinical psychologist by trade. And, I really started my clinical training primarily in inpatient settings. And that's a lot of my earlier experiences were sort of in the hospital settings, working with individuals across the lifespan. So I worked with kids as young as 5, all the way up to like older adults. And, that experience really gave me a really deep understanding of severe mental illness and the ways that, just distress and pain and difficulty can really present in a really diverse way. And more importantly, the importance of working with a multidisciplinary team. It really takes a comprehensive team, I feel, to really address the whole person
Yeah.
and being able to kind of look beyond the symptoms and really sort of help the individual kind of understand what's going on with them and really meet them where they're at despite how they're presenting. Because, we see people when they're most vulnerable a lot of times, and it's hard to not look beyond how they're showing up and kind of see who they might be outside of that. So that was a really sort of pivotal experience for me clinically, and I would say personally as well. And so, with those skills, I sort of developed, allowed me to develop sort of my practice right now. So, like I said, a lot of my experience has been within inpatient settings. I completed my internship at Sharp Healthcare in San Diego. I earned my doctorate degree from the Wright Institute in Berkeley, California, where I'm actually also faculty right now. So that's always exciting to kind of go back to where I came in as this bright-eyed doctoral student, and now I'm going back in this sort of different format and worked in different sort of larger institutions like Stanford, Kaiser, a community hospital, and more recently in the last couple of years, really went more full-time private practice, which has been great. So specifically outpatient, working primarily adolescents and adults in individual therapy focused on trauma and severe mental illness, and then also psychological assessments.
Yeah.
So that's me clinically.
Okay.
3 things that make me happy, which I think is such a great question. Number 1 is, I feel like I have a zest for life. So meeting people, whether it's sort of like these brief micro interactions and having someone just smile at me, in my work, so I give so much. And so it's always nice just to have people give back to you, even if they don't think they're doing that.
Absolutely.
We'll even have an opportunity right now for us to talk, and have a conversation. That's something that makes me happy. I love to travel.
Okay. Favorite country?
Ooh, that's a hard one.
That's probably the hardest question.
Yeah, I feel like they're all my favorites, but in different ways.
Okay.
I don't know, actually, all of them. I'll give you
the
a
whole
different answer. But the most unique that I've been to, I can answer that, is Peru. I actually got back from
Cool.
Peru a few weeks
I've
ago.
heard this. Yeah.
Yeah, very unique, very beautiful. Got to go to Machu Picchu, which was quite the experience. So traveling makes me happy. And then I have a dog, and spending time with family. You
Aw.
know, it's always like coming back to home base, I always say, makes me happy.
I love that. It's interesting because I asked this question to quite a few folks, and it's a funny question, right? Because like, happiness in itself is a funny word. It's more of a culminating emotion. It's not really. I would even argue it's not quite an emotion. It's like a distillate of different experiences. But it seems like for a lot of folks in the world today, human connection, like
Well,
things that just create and fortify the human bond,
yeah.
is something that I think a lot of people are craving, which makes sense. I mean, that's the heart of your work.
Yeah. Because I'm so glad you brought that up. You know, that's at the core, right? And there's
Yeah.
such, I think, a pattern of loneliness out there. And the ways that human connection, obviously, it looks different today with technology and everything, but you know,
Yeah.
such a still important need.
Well, to dig into that a little bit, Karen, I know like loneliness is something that obviously majorly talked about topic. You know, former Surgeon General, that's, Vivek Murthy, this is like his big campaign of just like, we're in a deep loneliness epidemic. Yet we live in a time of deep connectivity. And with you being just north of the heart of Silicon Valley, I mean, what are you seeing? Like from the everyday clinician standpoint, like how is it possible that we have the smartest minds in the world building tools supposedly to enhance
Mhm,
connectivity,
mhm,
yet the exact opposite outcome is resulting?
mhm.
And yeah, what are you seeing in your practice? Like, is loneliness one of the biggest factors in what you're treating today?
I would say yes. I don't know that folks would sort of label it as loneliness, but you know, I would certainly say yes. You know, that shows up in the way people feel like they don't have time for themselves, they don't have time with their
Mm,
loved ones. If they do, there's a tension around it. So even when people feel like they're sort of connecting, there's sort of like this way in which the connection feels superficial.
mm,
And, you know, there's still the unmet need of that full in-depth sort of level of safety, connection, and trust that comes with sort of like that can be disrupted with loneliness.
yeah,
And so I think the answer is to like kind of the why it's so
yeah,
complicated. You
yeah,
know, to the point, I think social, you know, technology has offered us so much
yeah,
as far as like, you know, ease and making things more, the efficacy of things
yeah,
and the sort of price that we've had to pay. You know, I wonder if the sort of flip side is sort of like that balance, right? What is that balance between how do you have this thing where there's so much ease that come with it, but
yeah.
it also can be this sort of deterrent for connection, whatever that means to each person.
Interesting. Do you think a lot of that has to just deal with the physicality of relationships? Like, you can talk to someone
Yeah.
like, over a text message, and instantly, like you said, it's so easy to text anybody or find anybody in the world today.
Mhm.
But what you're saying is, it sounds like that friction, the sort of the energy required if you're going to go meet a person in person, someone in person, or if you're going to, you have to put in effort. So what
Mhm.
it sounds like you're defining effort is perhaps a vital ingredient
Mhm.
to the quality of relationship.
Certainly. Yeah, like the effort, the investment piece, right? You
Mhm.
know, I think about when I was a child, right? You
Yeah,
know, how do we hang out? You know, you took the time to walk to your friend's house, right?
literally.
That's effort. There's an investment of time there, right? And then having to do that every day, you know, you're
Yeah,
stepping outside your home, this sort of like safe space, and then you're cultivating a new safe space with someone else, and you're both sort of investing in that way. And that's totally shifted, right? So I can just do that with the click of a button.
totally. Do
And
you
so,
remember knocking on doors? Do you
yes,
remember like knocking and ringing the doorbell? Be like, "Hi, is XYZ around to play?"
right.
That like I don't think happens anymore.
No, no. But there's like there's also a social growth that comes with that.
Yeah. It's like you're putting, as a little kid, you're going to a big giant door.
Mhm.
You're ringing the doorbell.
Right.
what is the state of mental health? I'm a father of 2 daughters.
Mhm.
Mental health is obviously my work, but always on my mind of, are they getting the attachment that they need? Are they getting the socialization that they need?
Mhm.
Um, you know, what's showing up in your practice? Because I cannot remember a single person in my childhood
Mhm.
who has had a therapist. I can't
Mm,
remember an adult with a therapist, actually.
yeah. Oh, interesting.
And so what's bringing in kids to therapy these days?
Oh, that's such a it's interesting. It's a couple things that, I've noticed, and I've actually talking with a fellow clinician about this. The sort of gap that's widening, it feels at least, between like young girls and young boys,
Oh,
and sort
interesting.
of like how they're socializing with each other. And so I think I read a research, I don't know how long ago it was, about just like the rates of substance abuse reducing in teens and the rates of teen pregnancy reducing in teens, which is
Yeah,
often positive things, right?
yeah,
But I also wonder if there's this other piece of it, which is, well, why? What's part of the why, and which is the ways that,
yeah,
feels like, and I see this a lot in my practice too, where the ways in which men and boys and girls are interacting are different.
yeah,
Some of these sort of underlying issues still exist when we think about like social media and like girls, as far as like body image issues,
yeah,
depression, attractiveness, those still exist. But certainly for girls in this grander scale based on this, technological idea of beauty. And
yeah,
then for boys, this idea of like masculinity, right? And also like going through this sort of developmental process.
yeah,
And yet, there's sort of like this failure to launch
yeah,
perspective that, I would say teen boys are, I would say there's an energy around that.
yeah,
And the moms are actually the ones coming and expressing concerns about some of these things, right? Because they have their young sons at home. They feel like they're not really doing much, right? They're not getting in trouble, but they're not really sort of going to school, socializing, all those things that you would, maybe when we were kids or teens, we were
yeah,
like getting in trouble, driving, going joyriding with our friends.
yeah,
They're not really doing that. And so that isolation and that anxiety for boys, looks different for girls, at least, in my practice and some of the conversations I've been having with other clinicians.
wow. And how does it's interesting because it sounds so foreign, and aging myself, I'm 40. And so when we were growing up,
Yeah.
it was all about having the car, right? The car
Mhm.
was the pinnacle moment of freedom and having
Right.
access to mobility and transportation to move around the world and socialize in the world. And now I think, like you said, because of access, you can just text anybody, even at a young age, they can access this world of Roblox and discover a
Mhm.
whole world. What is failure to launch? Like, can you help from your standpoint? Like, what is the definition of that term
Mhm.
in today's society? Like, what are we trying to prepare for? What are we trying
Mhm.
to prepare boys for?
Yeah. And I think that's a great question. I think when we think of like development, also, we're peers.
Yeah,
You sort of have this milestones that it feels like we're supposed to hit.
yeah,
Right. It's like obviously when you're a baby, walking, talking for the first time, but as you're growing into adulthood, it's like you said, getting your license at 16, you know, maybe going to college at 18 or moving out of your parents' house at 18,
yeah,
graduating college at 21, whatever that is, having your first boyfriend or girlfriend the first time you lose your virginity, things like
sure,
that. So
yeah.
some of this, what feels like pivotal social milestones or sort of social developmental milestones that we're supposed to hit, seeing that less and less for young folks hitting that around that same timeline. So when I say failure to launch, how I define that, or sort of what that looks like for me, is in the ways in which there are folks who just are feeling
Yeah,
stuck, not really motivated to do much of anything because their whole world has sort of been so insular, right? The bedroom, their room has sort of been this way they've created it and curated it where it's like, well, I don't need to leave,
yeah,
right? Everything that I need. So distorting the sense of like, social development, social connection, and then just sort of like growth as well, not being able to interact with the external world as well as they might with their own sort of internal world.
What is the this is so fascinating because I remember my room was absolutely like a safe space, you had your posters and all that stuff, right? Typical teenager stuff. But Like, what does the anatomy of a session look like when you're talking through this? Like, how do you talk an adolescent through getting out of their room?
Mm. Oh, that's such a tough one. I sort of think about it as this. If everything that you need, right? We talk about like those basic human needs of connection, vulnerability, trust, right? If there is this sort of definition experience that it's all here, why would I want to leave that? Right? Leaving that is more scary, right? Because there's a loss of control, and then I'm giving up something that's like really significant. And so it has been a challenge to sort of, if let's say a teen is coming in, they're struggling with like depression or anxiety, it has been a challenge. And of course, there's also certainly the mental health piece and the emotional health piece. Right?
Yeah.
It has been a challenge to sort of get the buy-in that the external world and engaging with the external world in this way is just as beneficial, and they can still get their needs met even more so than sort of staying stuck in this sort of world that they've curated for themselves. Also, if throughout their development, I wonder if they didn't really develop those social skills, right? Again, growing up, you and I, the benefit of going to your friend's house and knocking on the door is, you might run into that other kid that is mean to you.
Yeah. Yeah.
And how do you navigate that conflict, right? You might run into a parent who's like maybe not the nicest or having a bad day. So you just get more exposure to
Yeah.
different life things.
Correct.
You don't necessarily need to get exposed to if, you just have your computer or your phone, right? You get to control not being exposed to conflict or threat. And so if those skills are not developed, and then you're asking me to give up this sort of perfect world that I've
Yeah.
created for myself,
Correct.
outside world is scary. So why do that?
It's interesting. I think you're right. It's like it requires just like school, right? If you don't learn the basics of arithmetic, you can't go to geometry and things like that. Same thing in the socialization world. For those listening, like, what are some of the early indicators where you're like, hey, my child is not developing these foundational social skills? And then further along the road, hey, this is perhaps I am seeing signs of depression, anxiety. Like, where are those two things showing up?
Like early warning signs?
Yeah, like what are the early warning signs for a lack of socialization skills? And the second is depression and anxiety, probably on the 14 side.
So, for teens, some of the things are like, looking at sudden drop in like grades or just kind of refusing to go to school. I think a lot of times as parents or just caregivers, the focus can be on, well, they're just not doing well in school, right? And
Yeah.
focus, but we don't really look at the why. Lack of interest or motivation,
Yeah.
right? If you had someone who most kids want to at least spend time with their friends.
Right.
So if you're noticing a less desire to do that, those are some concerns. Irritability, actually. Like, are they more irritable? That could be another sort of warning sign to pay attention. And then just avoidance, just in general.
Yeah.
Avoidance of anything. That could also be a warning sign. I would say emotionally, if you have a child that's very clingy, so like there's an excessive reliance on their parent or the caregiver for decision making, like they really struggle to kind of make decisions, or they worry about that. That could be another warning sign. And then just that sort of underlying anxiety, like fear of whatever it is, could be another warning sign. And then withdrawing socially, of course.
So like it's kind of like it looks like, hey, do you want to go hang out with your friends? Their mom texted me and this is what's going on. And your child's like, no, I don't
Yeah.
want to. And how many, like, if someone's just observing, and I just really want to get a clear understanding. So if someone's listening, they know when there's a cue.
Yeah.
How many instances, like what's the difference between a normal, like, okay, they're just, tired from soccer or whatever, versus, hey, this is like something, a concern. Is there like a frequency level?
Yeah. Well, clinically, for depression, for example, we say at least 2 weeks, right, of consistent symptom presentation.
Okay.
And, for anxiety, probably like, let's say like at least a month, right? And then the severity of it will depend. To your point, things can be episodic.
Yeah.
But if you're noticing more of like a consistent, whether it's small scale or grand or a more grand scale, I would say, opportunity to ask more questions or be curious or talk to a professional.
And sort of like flipping it around slightly to the parent conversation. So, as a parent, obviously, we think about this a lot. It's like how much of it is instruction to the children and how much of it is modeling.
Mhm.
And do my wife and I, does everything emanate from us modeling? In your practice, are you seeing that? Is the lack of socialization by any part due to the actions of the parents?
Mm. Like when you say in action, what are some things that you're thinking like?
Just behaviors. Like what's coming to mind is, hey, and we do this all the time, right? It's probably not the best, but it's hard to maintain presence all the time. And so you'll sometimes look at your phone and jump out of your physical world context into something digital, whether you're open social media or whatever it is. Is it like, do you think it's a modeling thing? I'm curious, like in your practice, do you
Mhm.
hear like kids just like, oh, but my parent does that?
Sure. I wouldn't say that I would sort of
Attribute it.
just primarily to that, because that model, and I would say, I wonder how much it's reinforced elsewhere too, right? Even like a school, right? The school system has gone more digital, right? So there
Oh,
is that positive reinforcement if they,
mhm.
need to engage with that as well. And
Mm,
then, as you know, just like even with me, like I find myself constantly checking my emails on my phone. So much of our world
mhm.
has gone digital. So when a parent is just sort of parenting or moving about their day, I think inherently there always will be that modeling of, well,
Yeah,
mom and dad are on their phones, for example, or they are present as disengaged or disconnected.
sure.
So I wonder if it's really just the consistency of it, number one, and secondly, what does connection look like within the home,
I
and
love
how is it prioritized?
Yeah, it's funny because my wife and I connect so differently with our kids, but you can see that they receive it in different
Mm,
ways. Um, my wife's that typical mom, down on the ground, playing, hyper attentive. She'll literally crouch to get down to my 7-year-old's level and play with her. It's beautiful to watch.
yeah.
And I'm more traditional Indian. I'm like, "Hey, I'm gonna connect with you through cooking and food.
Mm,
What do you
mhm,
wanna" And that's, like, kind of a love language that I grew
mhm,
up with. Or like, "Hey, let's sit down and build something together," or whatever it is. Um, but I heard this recently that attachment is as vital of a ingredient to human life as air.
mhm. Oh,
Without attachment, we're wired for it. We can't survive. Things go haywire.
right.
Is that from a clinical lens, like, true? Or is that just, a nice to read on Instagram?
On Instagram. It is a nice sort of Instagram handle.
Yeah.
I would say just the simple answer is yes, but I would sort of follow it by saying, what type of attachment
Mm.
and how secure is it? How safe is it? Because, there, when we think about just being a child, right, with your children as babies, like when they were crying, what was your instinct? Right? It was
Yeah.
to connect with them, to soothe.
Yeah.
That's attachment, right? And if you do that consistently, that sort of builds healthy attachment, right? So I would say healthy attachment is as vital as air. Just that would be like the little caveat that I would add
Yeah.
to that.
Yeah. I like that. The quality matters, obviously. Switching gears slightly, talking about attachment, ChatGPT,
Yes.
super hot topic. It seems like everything is AI.
Hmm.
As HPY, we use AI, but we don't view ourselves as an AI company. We view ourselves as a tool for a human customer, for the human to human connection. But I've heard at least a dozen times in the past week that ChatGPT has shown up in my practice. Um, Would love to talk about that with you.
Sure.
What are you seeing? How's it showing up? What issues is it causing? How is AI becoming present? First in the negative, but then absolutely also in the positive. I want to understand both sides of the equation. How's it showing up in therapy today?
A couple ways. I would say in the last year, it's certainly been more present.
Yeah.
And I think as it relates to anxiety, what I am seeing, I would say, starting with the sort of the not so positive, with in relationships, I do work with couples sometimes and families, and the ways in which when there's conflict or discord, the ability to sort of repair and communicate that is a struggle for folks. So what folks are doing is to go to ChatGPT, for example, and it supports them in crafting really thoughtful,
Message.
right, messages. But the sort of lack of then how do you sort of personalize that before sharing that with the partner? That has actually caused problems because, the other person feels, well, this just feels too curated. This doesn't feel authentic. It feels superficial. And so those are some of the ways in which I have seen it sort of show up in a not so positive way. It's like, well, one person is trying to make an attempt at repair and they're seeking this resource, which is not a bad thing. It's actually a great thing.
Totally.
But the ways in which it sort of hinder their own ability to sort of put that effort, when you brought up effort, right? To make it sort of be more authentic so that that repair is actually positive. Another way that I'm actually seeing it showing up is people using it as therapy,
Yeah.
which is great, right? Again, it's an additional resource for when you're not working with your clinician and you're experiencing distress. You need something and you may not always want to talk to someone. And, you're getting really good feedback and the ways within that, just how does it still feel connected?
Yeah.
And then obviously the nuance of things kind of can be lost in that. And so there's just something that's missing, like that connection piece when you're talking to someone versus when you're talking to ChatGPT.
Yeah.
And I've had, patients tell me that after a while, and when patients feel like significantly distressed and they're maybe bringing up they're stuck, right? So they're bringing up the same things over and over. Their experience of, well, I just need something more. I'm tired of getting the same type of responses, if you will. So those are some of the ways in which I've seen that show up in my practice.
It's fascinating. Totally guilty as charged for using ChatGPT once. And this was like right at the beginning. I wanted to articulate a more thoughtful apology to my wife.
Yeah.
Granted, I did learn DBT skills. It was anchored in the give skill. So I kind of knew the framework, but I wanted to actually more deeply understand her perspective. So that's how I used it. But it left me with this interesting, a bit of an ick feeling. At least, and I'm curious, like, whoever's listening to this, if that's something to consider, is, yeah, it's commendable to want to use a tool to communicate a set of emotions and a sentiment that you're struggling. It's like buying, it could be the same as a birthday card for someone, right? The sentiment's captured in the card, but that doesn't replace writing in the card, right? And so I'm curious, like, if you were to sort of advise, like, if I was like, hey, Karen, can you give a handout to every person who goes to therapy in the United States of, you can use ChatGPT, you're already using it, but here's some guidelines. Like, what would be those guidelines in using a chat type interface in conjunction with therapy and in your emotional life?
Oh, that's such a great question and a loaded one. I always encourage folks to think, number one, what is the unmet need?
Oh,
Whether that's for you or like what you've heard the other person say about what their unmet need is.
yeah. I'm writing these down, by the way.
Oh, great.
We'll cite Karen Ego on it.
Okay. All right. So what's the unmet need? And are you sort of showing up, like when you're talking with ChatGPT and trying to get some advice, right? What is the intention for you? Are you showing up with the intention to protect your own sort of perspective and feelings, sort of like that, almost like that fear response?
Yeah.
Or are you showing up with openness and intent to sort of repair with the other person? Because that will certainly affect the questions that you're asking.
Absolutely. I love that.
Yeah. And also just like with most things, right? That's like in our control, right? You get the response based on the question that you're asking.
Absolutely.
Right. So so it allows for this level of control and in some ways hearing kind of what you want to hear, not what you need to hear. And so I would always start with those two questions or two reflection points for folks before they reach out to ChatGPT to get some advice and support.
I love that. I was just telling my team actually this morning, one of our advisors called ChatGPT sycophantic, which I agree. Fun word.
Yeah.
One of the ways that I've used it well, that I encourage everybody, is there's a part of the tool where you can put in custom instructions. Now, what custom instructions do, it sort of sits on top of all your conversations. You can provide it various attributes. Hey, I'm a dad. I want you to provide response in this manner. One of the things that I've done is I always ask it to provide me counterfactual evidence for the response it just gave me. Why is the response it just gave me? Why could it be wrong? And that's been incredibly effective in any interpersonal conversation I've had, because what it's doing is it's making me think. It's putting the processing of the thought back onto me to actually come to the conclusion versus being like, hey, this is the answer. Let me just go export this and then I'm done.
Oh, that's great. I had no idea. I'm going to actually do that on my own chat.
Absolutely. And fun fact, we have that baked in HPY. So it'll help you think as a clinician.
Wonderful.
No plug for our business. But no, this is really fascinating because I think it seems like there's a shift. It seems like you have folks in the clinical world who are feeling incredibly threatened by AI, the advent of AI, wondering, am I going to have a career or not? Then you have this middle ground of folks. I can see this transition happening where they're like, well, it's here. Let's find the right ways to use it. Let me be aware of it. Let me use it in ways for my practice. Let me introduce my clients. And then you have folks on the other end of the spectrum who are like, hey, look, like this is a whole new way to do mental health. Like AI therapist in your pocket is totally acceptable and it's okay. And yes, we should actually go give it a designation and a title and credentials as a digital therapist.
Yeah.
And so where are you finding yourself, like on one being like, please shut this down, should not exist. 10 being like, let me virtualize myself and become digital Karen. Where are you finding yourself on that spectrum as you relate to technology?
I would say I'm in the middle. I know this is something that APA is also like, evaluating and trying to integrate, and some of the ways in which some of this already is here, right? Like you said, in healthcare and things like that. I'm in the middle. I actually see the value and have always seen the value of tools like ChatGPT.
Totally. Yeah.
But I think of it as like a really, really great assistant. Right? So like a really good passenger, but not the driver.
You stole our taglines.
Great minds think alike, as they say. So, and that's the way, when folks that I work with, bring it into session, I don't sort of resist it or sort of, express judgment about it. It's like, I try to be curious as to, what is the sort of benefit? Like, what were they needing at the time? Why they felt like this was the go-to option for them. And then are there other ways where we can replicate that, from like a human connection, this human interaction that we're having. And so to your point, it is here. It's just going to get better. I am of the mindset, at least right now, that it will not replace, sort of clinical clinicians, right? Especially really quality clinicians. But I think it's a lot of what we talked about earlier, right? That connection piece. That human connection piece. And, there's just something that's invaluable in being able to sort of have someone put eyes on you, sort of sit with you, hold space with you, witness you, right? In your distress and in your needs that can never be replicated by AI, in my opinion. And so, I think there's an opportunity for both worlds to sort of merge and be able to offer something really great to humanity.
I love that perspective. And I think it's very balanced. And I think it's probably I think it's the right place to be, because there's also this curve of maturity of the technology as well. I don't know if you know, but the paper that started this whole large language model revolution was attention is everything.
Oh, I had no idea. Okay.
And so it's fascinating because, like validation of experiences and the human experience, it's fascinating because you've put that in your pocket and everybody has access to that. And so what's really required is a level of questioning. And it sounds like to you, I think the figurative word I'm taking away is intentionality. What's the intentionality and what's the unmet need, the self-observation, the separation of self. Now, switching gears on the other side, how, like, I know there's like us as one of the people building this, there's a handful of folks trying to build tools for clinicians. And it seems like you can pick one of millions of note takers because for some hilarious reason, every technologist thinks that's a great place to start. And it does save time, and I think at HPY we do a good job with it. But as we're evolving and moving, there's more coming. But what is, if you're to dream up, like you're an emotional container for a lot of people, every single day, that's a lot to hold. Where do you think on the non-client side, on the clinician side, the opportunity lies for AI? And like, as a practice owner, as someone who's trying to grow their practice, like, what do you wish existed?
Mm. Well, there's so many things with running a practice, especially if someone is in private practice. This sort of, that comes with, it's a business, right? And so there's some of these frustratingly but important small things that sort of create this cumulative effect of time away from whether it's clinical work, personal time.
Yeah.
But I think that AI and technology could really sort of address that. And, from a note-taking perspective, for example, I actually see the value as a clinician of writing your notes because that is part of the patient care, in my opinion.
Yeah.
Right. However, there are things that are sort of that need to be automated, right? And so having AI just sort of really pre-populate that, that's great. Right. So the extra couple minutes that I would take in writing that out over time, that saves me a lot of time, right? Whether it's just like taking breaks in between my caseload. I also think about things like, sending out automated emails and messages and reminders. Again, those sort of assisted type tools, that's where I think AI could really, really be helpful. And you said something earlier just around, obviously there's a human element in the room, which means that there are things that as a clinician, I might just miss.
Yeah.
And so the AI being able to capture certain emotional sort of output that maybe was just so sort of small enough that, or we were talking about something else that as a clinician, I don't remember to return back to it. So if I go back and sort of review the AI sort of interpretation of the session, opportunity to sort of gain more clinical information that the sort of like my human, like based on human error, I just wasn't able to pay attention to in the moment. And then which can allow me to sort of pay attention to that next time.
Yeah.
Sort of bring that up with the patient next time. So from a clinical standpoint, I also see that as being invaluable if that is something that can be sort of created.
Yeah. I love that. And I think hopefully at HPY, it's very in line with what we're building. I'm going to flip a funny question on you right now.
Okay.
In that response, in what you just expressed, the opportunity lies. What is your unmet need?
Oh, look at you. You're throwing my question back at me. My unmet need from a clinical standpoint? I think it's feeling that I have a handle on all the things needed to support the folks that I work with. It's like, yes, I show up in the room, I'm an excellent clinician, but there's all this sort of things that happen outside the session that is still part of patient care. And in the ways where I can feel that I'm not as connected or as sort of, that's not as contained for me as within the session. And so, being in practice, it's different than being in a hospital setting. So if a patient calls me in distress outside of their session and I'm with someone else,
Yeah.
There's a naturally like a sort of anxious response to that. I still have to address this, but I may not have the capacity in that moment. And so how to still feel like I'm supporting the patient in the way that feels good for me and that feels clinically appropriate. So that can always be a challenge as well, along with things like paperwork and just like, if maybe someone's just like in crisis and they just kind of want to touch base with you really quickly. But I may not have that 5-10 minutes to sort of respond to them. Then of course they go to like ChatGPT, which is great. But the ways in which when people are seeking out for that sort of human support, really, not being able to sort of always offer them that.
Is there a feeling of guilt in there?
Absolutely. Absolutely. Clinician guilt is always a thing, right? And then I talk to my own therapist about that.
It's funny because I feel like in the whole world, it's like to that original question of like attachment and connection is so vital that I almost wonder. I always think back, and this is my fun example of the world of like we all lived in villages of 100 people. You know, there's an elder, there's a couple elders in that population that you could always turn to, and that was just part of our society. And it seems like, not to sound like a song lyric, but we just don't talk anymore.
Mhm.
You know?
Yeah.
And it seems like that's puts a lot of burden on you as a clinician because when people are having problems, I mean, it's fascinating. When they're in crisis, you said either they talk to you or ChatGPT, which seems like a massive opportunity for society to rethink itself a little bit.
Sure. And I think from the clinician's perspective too, there's always that balance because this is still a professional relationship,
Yeah.
right? People might reach out to me because in that moment, it's great that they obviously feel safe enough to reach out, but I'm not their friend, right?
Totally.
That's the reality. I'm not their family member.
Yeah.
So there's always this boundary that you
Mhm.
have to hold. And so, as a clinician too, that sort of human element of showing up. And at the same time, it's like, well, how is this clinically informed? So
Yeah.
always, having that balance because you don't want, and I don't want my patient to be emotionally dependent on me. That would be causing harm to them.
It's funny because it reminds me of, you know, I'm no stranger to therapy, and when I did a Linehan certified DBT course,
Mhm.
I remember reading about phone coaching, and I used it, like, maybe, like, twice,
Mhm.
and I was just so fascinated because the idea of, "I can't be there for you, but here's a tool," is one of the
Mhm.
powerful constructions that I wish,
Mhm.
world knew more about, where
Yeah.
it puts the ownership and control, be like, "No, you can change the response to the conditions that are happening at that moment."
Mhm.
And
Right.
here's a set of frameworks and tools. And I
Right.
think that's something that is fascinating. I hope one day we get to building that in HPY because I think that's a very powerful tool.
Yeah. Yeah, yeah. I think what you just said, and that's it, right? That's the hope and goal of therapy,
Yeah,
which is, getting that person to sort of really connect to their own sense of like self-efficacy, right? You get to control your own experience and you're not dependent on
yeah.
someone else or something else to support you in that.
Uh, One last question that I want to close on is sounds like you put your heart and soul into your clients and your practice. And in the off chance that a client is listening to this, because the relationship is professional, but it is emotional. You're opening your heart in that session, the biosocial theory of developing that space together. How would you describe clinician exhaustion and burnout? And I know we asked about adolescent burnout, but for someone listening to this, what does that look like? And how does it feel if you were to describe that? Just, I want to be there for you, but I don't have it right now.
How to communicate that to the person, the client.
Yeah.
I think for me, the number one thing or the first step is to really sort of communicate that from the beginning. I would say that is part of it, it's informed consent. I feel it is my duty to sort of like allow the person to understand
Yeah.
that there is a container to the relationship that we have. And it was interesting because I even had to sort of do some work to really understand the language of even using the word relationship.
Yeah.
Some folks, that is a pretty deeply meaningful, powerful word, and it means something different to them than how I sort of was using it in a sort of clinical sense.
Yeah.
But when I landed on what it is still a relationship, and there's a connection, there's an encounter in our encounters.
Yeah.
And so, but understanding how this is different than maybe other relationships that you have, that's very, very important to me.
Yeah.
And, you know, part of my style is I like to bring in sort of like the human element. So
Absolutely.
I
I can
talk
see that.
about what's happened between us.
Yeah.
I'm
I love
like,
that.
"Hey, you're coming to me. Yes, you see me as an expert, but what I am an expert on are maybe patterns
Yes.
of behaviors, but I'm not an expert on you."
Mm.
And so
Oh, I
because there is
love that.
because there is that human element, right? It's like I might also come in with things too. And part of the work where it feels collaborative for me is when things are feeling, when there's ruptures, you know, how do we sort of address that? So those are the ways in which I talk about that. And then that is also an opportunity for me to sort of reinforce the message that, and also there's a boundary here. And I think an opportunity for folks to really look at, well, boundaries can also be healthy things in relationships
Yeah.
and see that as positive too.
I love that, Karen. I feel like I could talk to you for hours.
Likewise.
If folks want to learn more about you and your practice and find you and work with you, where can they get that information?
Yeah, so my practice, drkarenagu.com. You can always check on my website, hear a little bit more about my practice. I have a psychological assistant that works with me as well, so you can hear some information about her work.
Awesome.
And we're located in the SF Bay Area, so feel free to reach out. Always happy to have a consultation with someone who just wants to learn more about my clinical work and practice.
Well, thank you again for being on the show, Karen. It was delightful to talk about a whole many different things.
Yeah.
And have a really wonderful day.
Thank you. Thank you so much, Anurag. I enjoyed my time together, and enjoy the rest of your day too.
Thank you so much for joining us for Happy Hour. We hope you walked away having learned something and feeling a little less alone on the journey. If you liked what you heard, it would mean so much to us if you subscribe. You can be notified every time we have a new episode. To learn more about what we are doing at HPY, go to thinkhpy.com. Until next time, we hope you feel heard. Take care.